Ptosis means a droopy eyelid. It's spelled with a silent P, so it's Ptosis, coming from the Greek meaning to fall. And we see a lot of ptosis. The causes of ptosis are, there's many different causes, but the commonest cause by far and away is due to wear and tear. So as one gets older, the tissues become weaker and stretch, and they can detach or dehiss or separate from the original attachments, resulting in a droopy eyelid. Also, some children can be born with a droopy eyelid. There are other causes such as neurological causes, which are very rare but serious, and so doctors will usually screen those out as part of the assessment. And then there's things like mechanical causes, like having a lump on the eyelid, like a sty, or some other growth that can push the eyelid down. And the mainstay of treatment for ptosis is surgery, and it's a nice surgery to do because patients are usually extremely happy with the results. It can make a huge difference to their appearance and their confidence. When patients have a ptosis, it can make them look quite sleepy or a bit sad. And having ptosis surgery can really transform their appearance to make them look more awake and more happy, and it can really make a huge difference to their quality of life. The bulk of the swelling happens in the first week after the surgery. The swelling will remain for several weeks to months afterwards, but after the first week, the swelling is usually fairly minimal. So I'd say in terms of time off work, for example, I'd have at least 1 week off. If you're in a very public-facing role, you might want to have a couple of weeks off. But you can get back to daily activities within a week or two.